do the same with healthcare policy? All right, here to help us answer that is my buddy, Republican Congressman Michael Burgess of Texas. Michael, we appreciate you being on. I get a little just crazy about this. It's all literally amazing to me that we have come to this point where, 25 people in a room have decided that they're have a better way, an idea to solve this $2.7 trillion problem than the market. How did we get here? You know both sides.
Well, and their idea is so good, we are going to pass it without voting on it by passing a rule which deems the bill as having been passed. What nonsense. If this was a good idea, it really wouldn't be a very heavy lift to get it all done. But since it's not a good idea, and you've already articulated some of the problems, boy, administrative pricing in our healthcare system in Medicare is one of the things we all complain about, the fact that we pay too much for the wrong things, but then we keep incenting the wrong things, and then we wonder why doctors do those things to us and for us. It really flies in the face of what's logical. Governor Mitch Daniels in Indiana, in the Wall Street Journal, either this week or early last week, had a wonderful piece about the power of putting the dollars back into the hands of the patients and then letting the patients and doctors make the decisions. He has, I guess, the largest group of public employees and his state employees on a health savings account.
He does.
He puts money into the health savings account for them. He's seen a dramatic reduction in utilization, a dramatic reduction in costs. People have more money in their pocket and more money to spend for the medical needs should they arise.
Doctor, this is what gets me, and I think it's what frustrates so many Americans, is that Indiana is a perfect example, because here's a system that is working in real time, not in fantasy land, not in academia, but in the actual reality. Then we go to the state of Massachusetts, which came up with a plan, and it was not a good plan, that we almost, are modeling to take to the entire country. And yet in the real life experience in Massachusetts, we found out that, well, first off, the actual medical cost per, enrollee in their plans is 112% of what they bring in. That, I'm not a smart man, but that seems a little wrong. Then their premium rates have gone up highest in Massachusetts since they came up with their reform plan than any other state. So why is it, and you're a congressman, and I'm going to hold you accountable to this, how is it that you guys or someone is taking the plan that doesn't work and want to do to all America and ignoring the plan that, for instance, is working in Indiana? I don't understand.
Because we never had the hearings to really ask the question, what works and what doesn't, and what should we be considing.
Well, what were you guys talking about all that time?
The other bigger issue is, Toby, that we've had this mindset that we must, at the federal level, dictate what people buy in terms of health insurance. Well, that's preposterous. That's never happened before in the history of our country.
Right.
It's okay if Massachusetts wants to have a mandate. They elect their state government. If they put forward a mandate and the people accept it and don't throw them out the next time they have a chance, okay, good on them. What works in Massachusetts wouldn't work in Texas. And we see what's working in Indiana within the state employees. Why don't we give states the freedom to do that in their Medicaid population? We had such a law in 2005. It got repealed with the state children's health insurance extension that Barack Obama signed into law a year ago. We had a chance to actually reform some of these programs so that they would actually work for patients, particularly poor patients who need the most help, and we just simply refuse to do it.
Well, I mean, I've never been I'm actually anti-conspiracy theory, but if I was a conspiracy theorist person and I, cue the helicopters coming through, I would think that the only real reason you would propose such a, conglomeration of distortion and unreality, i.e. this plan, would be that the real goal of this plan would be to grab the entire healthcare system and go to a single payer. It's the only thing that makes sense here, the way this is constructed. Am I, conspiracy theory out here? Am I getting, too off track?
Well, personally, I never attribute to coincidence that it can be adequately explained by conspiracy theory.
Thank you, Doctor.
I think you may be onto something.
I'm not paranoid. I'm just really paranoid.
that when we saw all of the the anthem rate increase in California right before the president had his summit. Holy cow! What, is that just phenomenally bad timing, or was that done on purpose? Because it certainly didn't look like either someone's not paying attention to what we're doing in Washington, or they just simply don't care and they're pushing a different agenda.
Yeah, that's, again, I think that's just a little mysterious too, isn't it? All right, so you've been fighting the good fight here. Are we going to actually get this vote? I mean, is this non-vote vote, the slaughter rule? We used to call slaughter and dodgeball. Are we going to actually have a non-vote on this thing to pass a $27 trillion thing?
I cannot believe that. that Democrats would actually do this to themselves. This is the worst type of self-inflicted damage that a party could do for itself. Never mind what it would do to the country. Never mind what it would do to doctors and patients. It is political suicide to follow these guys over the cliff. Yeah. I cannot believe that Democrats would vote against their own survival and self-interest in passing the slaughter rule.
Let's not, never say never, by the way. There's a lot of stuff that's like, I love having you on. Please fight the good fight here and keep us from, ruining our country with an idea that was, where we had such a great, wonderful, entrepreneurial system before. It'll come back. I'm confident. And sticking with health care.
Absolutely.
All right. Thank you, Doc.
It always does. Yes. Great. Thank you.
All right. Sticking with health care here. There's a congressional proposal to pay obese people to lose weight. Is this idea a winner or loser? Now, here to score it for us, my buddy, Fox Business contributor Gary B. Smith of Exemplar Capital, and Mimi Roth of Action